Exposing the hidden danger in your food, how a pork tapeworm can cause epilepsy. This tiny parasite, often invisible to the naked eye, can have devastating effects on human health. Neurocysticercosis is a condition that occurs when a person accidentally ingests eggs from the pork tapeworm, Taenia solium. These eggs can be present in contaminated food or water, and once ingested, they hatch into larvae that can travel through the bloodstream to various parts of the body, including the brain. This usually happens when food gets contaminated by someone who already has the tapeworm. Poor hygiene practices, such as not washing hands after using the bathroom, can lead to the spread of these eggs. In developing countries, it's the most common parasitic disease of the nervous system and the leading cause of acquired epilepsy. The lack of proper sanitation and healthcare infrastructure exacerbates the problem, making it a significant public health issue. So, how does it manifest? The symptoms of neurocysticercosis can be quite varied and often depend on the number, size, and location of the cysts in the brain. Many patients show no symptoms at all. In fact, some people may live their entire lives without ever knowing they have the condition. This asymptomatic nature can make it difficult to diagnose and treat early. But when symptoms do appear, they vary widely depending on where the cysts are located in the brain and the immune response of the host. Symptoms can range from mild headaches to severe neurological deficits. The most common symptom? Epileptic seizures. These seizures can be debilitating and significantly impact the quality of life of those affected. Epilepsy, seen in about 70% of cases. Other symptoms include headaches, which can be persistent and severe, affecting daily activities and overall well-being, dizziness, and even strokes. The presence of cysts in critical areas of the brain can lead to stroke-like symptoms, further complicating the clinical picture. Diagnosing neurocysticercosis involves imaging techniques like CT scans and MRIs. These advanced imaging tools are crucial in identifying the presence and stage of the cysts. These tools help identify the stage of the cysts, from the vesicular stage with viable larvae to the calcified stage when the parasite is dead. The stage of the cysts can influence the treatment approach and prognosis. These tools help identify the stage of the cysts, from the vesicular stage with viable larvae to the calcified stage when the parasite is dead. Calcified cysts indicate a chronic infection and may still cause symptoms due to the inflammatory response of the body. In terms of treatment, it mainly depends on whether the parasite is alive. The treatment strategy can vary significantly based on the activity of the parasite and the symptoms presented by the patient. If it's dead, the focus is on managing symptoms, primarily seizures, usually with anticonvulsants. These medications help control the electrical activity in the brain and reduce the frequency and severity of seizures. If the parasite is active, a combination of anti-parasitic drugs and steroids is often used. Anti-parasitic drugs aim to kill the parasite, while steroids help reduce inflammation and the immune response, and steroids is often used. The use of steroids is crucial in managing the inflammatory response that occurs when the parasite dies, which can sometimes worsen symptoms temporarily. In severe cases, surgical intervention may be necessary, especially if there are complications like hydrocephalus or large cysts. Hydrocephalus, a condition where fluid accumulates in the brain, can be life-threatening and requires prompt surgical treatment. Or large cysts. Surgery may involve the removal of cysts or the placement of shunts to drain excess fluid from the brain. Neurocysticercosis is a major public health concern in developing countries, but also affects immigrants in developed nations. The global movement of people means that this disease is not confined to any one region, but also affects immigrants in developed nations. Immigrants from endemic areas may carry the infection with them, highlighting the need for awareness and screening in healthcare settings. Understanding this disease and its implications on the nervous system is crucial for medical students and professionals alike. Education and training are essential in improving diagnosis, treatment, and prevention strategies. Remember, the key is early diagnosis and targeted treatment to improve outcomes for those affected. Early intervention can prevent complications and improve the quality of life for patients. And targeted treatment to improve outcomes for those affected. Healthcare providers should be vigilant in recognizing the signs and symptoms of neurocysticercosis, especially in high-risk populations. Stay informed and stay safe. Public health measures, such as improving sanitation and food safety, are critical in preventing the spread of this disease. By staying informed and practicing good hygiene, we can protect ourselves and our communities from this hidden parasite.